Hi, everyone. Good morning and good afternoon, good evening, depending on where you are. This webinar series has been created for our group of mentors, which includes all of yourselves. And we've been looking at both themes that are pertinent more generally for the field, hot button issues or things that we see as trends currently in the field for our some of our webinars, and the last webinar we had, which was on elevating practice-based learning, was an example of that. This webinar falls into a second category, which is really digging into a program, and a program that has been based on other previously evaluated programs. And so it's evidence driven, it's an adaptation, and we're looking at this for the potential of its own adaptation. What was adapted, what changed, what can be adapted from this program. So we're very pleased to have Erin Stern today presenting work that she's been deeply involved with, the Indashyikirwa program from Rwanda. And Erin's been working on this for the last number of years, and in fact just came back from Rwanda, where she's been talking with the program participants about some of the findings. And so she's fresh from the project site and here to give us deep insights into this this program. And again, please do use the chat box if you want clarifications during her presentation, because it is a complicated project. So to start the program, I'd also like to give you a few words of introduction for Erin. Many of you met her in Istanbul, but Erin, we're so pleased to have you. She's a qualitative research specialist focused on informing and evaluating both gender and health programs. And she has worked on gender-based violence prevention and response, HIV/AIDS, sexual and reproductive health programming, primarily in Eastern and Southern Africa. Erin has conducted formative and impact evaluation research for various organizations, including AIDS-Free Worlds, CARE International, Promundo, KMG Ethiopia, the Oak Foundation, Sonke Gender Justice, and UNDP. She has a wealth of experience in capacity building with practitioners in qualitative research and teaching university students. Erin is currently based in the UK and is an assistant professor with the London School of Hygiene and Tropical Medicine. So Erin, with that, over to you and to the presentation. And thank you all so much for joining.
Great. Thanks so much for the introduction, James, and nice to be with you all again. So just to introduce the various partners involved with Indashyikirwa, which means agents of change in Kinyarwanda. So the program was implemented, just actually finished last month, by 3 partners in Rwanda. So CARE Rwanda, RWAMREC, which stands for Rwanda Men's Resource Center, and Rwanda Women's Network. The program was also extensively evaluated as part of the What Works to Prevent Violence Against Women and Girls program, which is the role that I have played. And the key kind of partners involved in the evaluation have been LSHTM, where I am based, and also the South African Medical Research Council, where some of the other principal investigators are based, and which coordinates the global What Works program. So just for the context, for those who are less familiar with Rwanda, and some of this context really comes into the findings because this program has been piloted in Rwanda, and a lot of the lessons learned around adaptation very much relate to this context. So it's a very small, very densely populated country, and that has implications on how it's worked with community diffusion, how it's worked in terms of governance. It's very well organized and also very decentralized governance. There's a lot of existing community forums, and a lot of, even in these very rural, remote areas where the program took place, there's actually quite a lot of legal and political literacy because of this very decentralized government. And I'll talk a bit more about that in the findings, but just to give that contextual background. There's also quite a progressive framework around women's rights and a very strong anti-GBV framework, and that's all been happening quite recently within the last 20 years. But despite this very kind of strong political will and legal framework to protect women and girls from violence, intimate partner violence in particular remains very high. It's more common form of violence against women and girls. And, there's still very prevalent social norms that condone certain forms of violence against women and girls. And again, we'll talk more about that in the findings. So this is the context that the program has been embedded within. I also want to turn a little bit to the history of Indashyikirwa and where it's kind of evolved from. And as James mentioned, it very much drew on other evidence-based programming in the field, some of which others in the room have been involved with. So in 2012, back quite a few years ago, CARE Rwanda did an assessment of their Village Savings and Loan Association program, which was microfinance programs targeting the most kind of vulnerable economically in society, and particularly targeting women through small loans and to kind of form these groups together. But they found that many women were actually very unconfident to use the money for themselves. There was a lot of experiences of economic abuse in terms of the money going to the partner and not being repaid back. And actually for some couples, it could be a trigger of conflict and violence for the women to be bringing in an income to the home, which changed those gender dynamics. So a few years ago, CARE, in partnership with RWAMREC as well and Promundo, facilitated a 17-session curriculum, which was very much trying to engage partners of VSLA members to support women's economic empowerment and to really foster a kind of partnership model of economic empowerment. This is called Journeys of Transformation, and the curriculum is on the Promundo website for those who want to learn more. And the evaluation found this did have a positive impact on household collaboration, greater decision making among women, supported kind of joint partner relations around making joint economic decisions and in support of women's economic empowerment. However, there was not as clear a reduction or focus, in particular in gender-based violence. And another thing that the partners on reflection talked about was that a lot of the couples spoke about a kind of sadness that the program just ended after the curriculum, and they actually requested skills and more support to scale up what they learned, in a sense kind of this enabling environment activity or even kind of efforts to do activism. So as we'll see in the next slide and throughout the presentation, Indashyikirwa built on this work with couples, but very much scaled up activism. And the primary program it drew on to inform activism was SASA, established by Raising Voices in Uganda. I'll turn to the next slide to talk more about that. So you'll see throughout the findings, SASA, Indashyikirwa is a SASA inspired. It's definitely not a kind of exact adaptation of SASA, and I'll speak more about why that's the case. But it very much drew on it, informed the curriculum with the different stakeholders that I'll talk you through. It informed the sense of community-based activism, which the program partners realized there was a real need for. This sense, some of the fundamentals of SASA that are spoken about in the fidelity brief, this positive and negative types of power, very much informed the entire program. Also ways to inspire people rather than this idea of, what are the consequences of violence? How do you use a benefits-based approach, drawing people on, what are the benefits of a life free from violence? So using this very kind of benefits-based messaging, and also not just stopping at attitudes, but really in supporting change skills, actions, and behaviors. So a lot of this fundamentals of SASA, which were shown to be critical to address GBV, were incorporated into Indashyikirwa. One of the innovations of Indashyikirwa that I'll speak about more is that it has a much stronger emphasis than SASA did even on working with couples directly. And again, as I mentioned previously, drawing on the work they had already done with couples through the Journeys of Transformation, which was found to actually be extremely appreciated, both by men and women. And then one other area that Indashyikirwa scaled up, which you don't see as much of this in SASA or even in the Journeys of Transformation, other programs that had been drawn on, was the sense a kind of concern of if they were going to start raising awareness at a community level and doing community-based activism and, you know, reflecting on the kind of issues underlying IPV, there was a real kind of concern that in many of these rural areas where the program was implemented, there's very limited access to or even awareness of health, legal, social, and counseling services to support people who are experiencing violence. And that if people start to kind of reflect on violence, identify something as violence, consider the consequences, was there going to be enough way to ensure that there was support? And especially with working with couples, there are different concerns and risks as well. And so wanting to ensure that there was safe spaces within the context of this program. And so another program element is what the program calls Women's Safe Spaces. And these were adapted from Rwanda Women's Network, which is one of the other key partners. They have had something called the Polyclinics of Hope, which are literally physical safe spaces. In the picture there, you can see a woman walking into one that they rent out, and they provide more of the response. Even though this is a community prevention program, they ensure that there's dedicated response as well. And I will speak more about that. But just to note that this is then really a blended approach. It drew on SASA, it drew on journeys of transformation that had been already implemented in CARE by CARE in Rwanda. It drew on polyclinics of hope and blended this to create a new model, which is Indashyikirwa. So Indashyikirwa, as I mentioned before, it was implemented across 4 years. It just finished last month. It was funded by DFID Rwanda, and it's been implemented in 7 districts in 3 provinces, Eastern, Western, and Northern province of rural Rwanda. So it wasn't in Kigali or any of the kind of major cities. It targeted the kind of rural and more socially, economically deprived background. Because of the fact that it had these 4 components, and I'll talk you through all of them now. The one is the participatory training with couples, and this is called the couples curriculum as part of the program, and I will go through each of these slide by slide, but just so you know of the kind of 4 overarching components. The second was a component of community-based activism with a subset of the couples that were trained through this couples curriculum. So it didn't just stop at the couples curriculum. Couples who went through this training were then supported to do ongoing activism. As I mentioned earlier, then there also a critical component was direct support to survivors of IPV through what's been called women's safe spaces, and how these interact with the other 2 components. And then the 4th was to train and engage regularly opinion leaders. And we'll reflect on the learnings, but I think these 4 components really well were thought out and complement and cater to each other. So let's go through one by one. So the couples curriculum drew on this experience that CARE had with the Village Savings and Loans Association. And as I mentioned, it meant that kind of the most socioeconomically deprived individuals are targeted. In Rwanda, they have different kind of rankings based on income and cost of living. And so these VSLAs are meant to support, you know, those at the kind of lowest grading on the socioeconomic scale. And it also draws on the fact that, you know, a lot of CARE's programming was cognizant that it could be trigger or risk for violence doing this kind of women's economic empowerment without engaging couples. And it was found to be really effective through journeys of transformation, but they wanted to build on this more fundamentally. So what happened was 840 couples, so, you know, double that in terms of individuals, were trained. They went through a 20-week training where they met once a week, and in each group there was 30 individuals, so 15 couples per group to make sure that it was small enough to be participatory and that everyone could engage. And they also had 1 male and 1 female facilitator. Before it was rolled out, so it took 5 months because it was once a month, but before it was once a week for 20 sessions. But before it was rolled out, it was pre-tested rapidly over 1 month where people came every single day who were not actually the couples that ended up being trained, but from a similar community. And the pretest was really valuable because this was a piloted curriculum. It drew on a lot of evidence, but it still had never been rolled out before. It informed things like the staffing. Having both a male and female facilitator was found to be critical through the pretest. and it informed ways to make the content more, appropriate to the context, with translations, and also the approach. And a kind of fundamental approach to the program, to the activism, has been this participatory approach, which, as we can reflect on, was very new to many of the staff and very new to many of the community members as well. So it required a lot of support to build that in. So the couples curriculum was really designed to foster change, drawing how SASA does as well, that you go through knowledge, attitudes, skills, and then behaviors. And this included not only behaviors to start thinking about, relationship behaviors, such as, to prevent violence, such as communication skills and conflict resolution skills, identifying and managing triggers of violence, but also behaviors and actions to start thinking about what people can do to prevent or mediate violence within their communities. Also drawing on SASA, thinking of how power imbalance is a root cause of IPV, and reflecting on positive and negative forms of power, both within their relationships, but also within their communities. But what Indashyikirwa, the curriculum, also very much drew on thinking about contextual triggers of IPV, and in this context, some of the key ones identified were economic stress, alcohol abuse, and jealousy, and identifying those as triggers, and identifying ways to manage those triggers, and also reflecting and thinking on positive alternatives to violence. So as I mentioned before, this really strong benefits-based approach. There was a lot of emphasis on spending quality time together and communicating together, and the positive alternatives this could have on children and families. So it had this very strong benefits-based approach as well. So the community activism component, what happened here was that 25% of partners of couples completed a 2-week activist training after the 5-month training. And these were self-elected. It was volunteer work for an additional 22 months. But they actually found even more than 25% had actually wanted to do this. The program just hadn't budgeted for that, but it was something that was very popular. And what happened was that SASA activism messages and materials were adapted to the context for this program and for this component, but other messages and materials were also added. So they had a lot of materials on drawing on key social norms in Rwanda and laws. One example is there had been a recent equal headship law in Rwanda. Before, even in the law, it was that the man headed the household, and so they wanted to raise a lot of awareness about this new law, which very much aligned with the principles of Indashyikirwa. They had a lot more focus on couples and relationships, so developed something called healthy relationship chats, and also more focus on economic equality. So a lot of the materials look at things like registering on land together, which can help ensure that women also access property, and building that a little bit more into the relevant community activism content. For those who are more familiar with SASA, they'll know that it's more activism, and in many actually programs, community activism tends to be more informal. In Rwanda, how it played out, especially at the beginning, was to be, as you can see in this picture, with quite large groups. Some activists sometimes spoke to about 50 people at once or 60 people at once. As I mentioned, there's a lot of community forums that exist in Rwanda and that were used. And this sometimes meant that activists would go back to the same group repeatedly. So again, drawing on these regular community groups that exist. It was also just found that it was seen as more comfortable for activists to do this use these formal spaces. Community activism is very unfamiliar in Rwanda in a very informal way, but it was, the activists and the program staff adapted to using these more formalized regular groups to still have community diffusion as well. So it did play out quite differently, which is interesting that, even this neighboring country of Uganda, it played out very differently in this setting. Again, those who are familiar with SASA know that there's 4 phases: start, action, support, awareness. And these informed the activism for Indashyikirwa, but the phases were more fluid. And in particular, the last 2 phases had to be quite combined due to limited timing. And I do think one of the lessons learned is, given all the time spent on inception and the curriculum approach and forming the activism, that they would have benefited from even an additional year to really reach the kind of time they needed for all the activism content. So that's that component. The third, sorry, this is just, as you can see, the ways that there's been a lot of careful adaptation of these posters and materials from the Ugandan context to the Rwandan context. So, you know, one example is the top middle image. You can see that in Rwanda, which is on the right, they've used like the traditional pot on the woman's head. Even things like the style of the way the baby is put on the back was changed to the Rwandan context. And so there's been a lot of ways that, as well as the messages, but just to make it seem relevant and applicable to these community members, which has been fundamental, I think, to the accessibility. Okay, the other component is the women's safe spaces, as I mentioned, and how these were structured. They were open 3 days a week, and there was one in each of the sectors, so in 14 sectors across the program. In the morning, the spaces were open for individual disclosure or just support for people experiencing GBV or forms of conflict, or just who wanted to maybe gender inequalities, issues in the family. So this was open to men and women, and there was a indication that there will be safe space facilitators who can receive support and also refer them or even accompany them to more formal services if that's something that they so desire. This could be property rights and meeting with a land mediator, or going to health or to police. In the afternoon, they were more open for group discussions, and IGA, so income generating activities, in many of the safe spaces took on an organic nature and was a very strong part of the afternoon sessions. There was, a lot of the, I'll talk more about this in the findings, but just to mention that they were there for response, but they also were there for prevention as well. In those afternoon sessions, the women's safe space facilitators would also facilitate drawing on some of the SASA adapted activism materials, discussions on IPV or gender inequalities, and also educate about rights in Rwanda. And the women's safe space facilitators, so Rwanda Women's Network trained them over 2 weeks at the very beginning, and then supported them through ongoing mentoring and coaching. But these women were nominated and elected from communities. They were not trained psychologists, or some of them had been like community healthcare workers, but they were from the communities and they were volunteers, and they were supported to play this role as facilitators. Then the final component of the program is opinion leader engagement. So at the beginning of the program, a diversity of leaders, including religious leaders, government, service providers, were engaged to really ensure an enabling environment to prevent and respond to GBV as part of this program. And then they were also trained an adaptation of the couples curriculum over 2 weeks at the beginning on, ways they could reflect on power and GBV prevention and response. And they were also provided ongoing refresher trainings throughout the program. There were also quarterly meetings that Rwanda Women's Network hosted with opinion leaders to share experiences, set goals, and identify solutions. And so there was this ongoing engagement with them as well. And they also self-evaluated progress as groups of leaders, so divided into, religious leaders, service providers, healthcare workers. And the program also supported what they called local dialogue forums using community scorecards, where community members could kind of hold opinion leaders accountable to some of those commitments. So that is the overview of the components. As you can see, it's quite a complex and really well thought out component, but I wanted to quickly turn to some of the lessons we're learning. Just to flag, I'm not going to be going today into the impact of this program. There is, as well as ongoing qualitative research, there is a randomized control trial both with couples and communities, and we're currently doing analysis, and we'll be looking at these kinds of questions. Did the curriculum reduce IPV and controlling behaviors and lead to more equitable relationships? And also whether this community activism, opinion leader engagement, and safe spaces led to decreased acceptability of IPV, more equitable gender attitudes, and improved support for survivors. So we are going to be answering those questions. I'll just mention that there's a wealth of qualitative research that's being done with basically all of the stakeholders I've just introduced you to, and at multiple times over the program, so that we can see their processes of change and engagement with the program. But for the sake of today, I wanted to reflect a little bit more on just what we are learning in terms of what works, and more on the process of the implementation itself, really drawing on, though, this qualitative research that has been external and part of the evaluation. So just to flag some of the lessons we've been learning from working with couples, I think the participatory group training for the length of time, so for 5 months, was found to actually be really important. And some of the reasons for that is at the beginning, a lot of the facilitators reflected that men were much more likely to kind of dominate the discussions. And this is not surprising given kind of a very strong social norm in Rwanda that in public settings, men dominate discussions. But what they did find was, by the 4th or 5th session, it was really starting to balance, especially through facilitators really trying to create a safe space and supporting equal participation. It was also quite important for couples to feel that they could trust the facilitators and trust each other with this quite open, intimate experiences. And so that those 5 months and that participatory space was actually seemed to be really important. Framing the power lens was really helpful. One thing that it was seen as quite helpful was, rather than emphasizing, or re-emphasizing these binaries of all men holding power and all women not holding power that some people had said had kind of come across in previous GBV messaging. It helped everyone think about how they have power and they can use power positively and negatively. This also was useful to think about balancing power as couples. Women in particular really related to the concept of power within. So this power language, to think about gender inequalities, but other forms of inequalities as well, was extremely relevant for the couples. In this setting, and this comes across the board in Rwanda, learning about laws and policies and rights that support some of these changes is a really, people are very enthusiastic about that, and it was really helpful as well to learn that through the curriculum. And then another thing is, the way that the curriculum supported skills building was especially through what was called take-home exercises. So every week, couples would be asked, say it was about communication, and they'd be asked to spend 15 minutes every day of the week communicating about something, and then come back and reflect on that. And then reflect on the challenges and the progress. And through that, a lot of couples mentioned they could witness benefits. They could maybe learn from each other what benefits were witnessed, and they could try new things and practice skills that way. Having a male and female facilitator was really important. Some people spoke about it modeled gender equality in the classroom. Sometimes they prefer to speak to someone of the same sex about issues or ask for counseling or advice. And so the curriculum itself as well, I think the fact that it drew on so much evidence like SASA really strengthened how accessible it was. So one thing to mention is there was a small stipend given each week, and we were just reflecting even last week with the program team that this did definitely support the dedication. There was something like 98% of all couples participated in the whole curriculum, and so definitely to think about this potential of like a travel stipend as a cash transfer, but that it also, some people reflected about how this was initially motivating, but it became much more than just the stipend. And as we'll see with the commitment to community activism for an additional 2 years, which was through voluntary purposes, this definitely wasn't the kind of only motivation, but it is something to think about in terms of a lesson being learned. Okay, in terms of what we're learning from the activism component, couples, this model of a couples curriculum before activism seemed to work really well, and many couples spoke about being committed to activism because of how much they had benefited from the curriculum. We learned that they really did require a lot of ongoing trainings, especially for using participatory approaches, which underpinned the activism, but it was very new for many of the couples. One thing as well, like the fact that both couples had at least been through the curriculum, even if only some of them became activists, they found generally that their partner was very supportive because they had also been through this curriculum together with them. And when both partners of couples were trained as activists, which was not that common at the beginning, an additional pool were added during the last year. So there was some, as you can see in this photo, so these badges are what they were worn to identify themselves as activists. So sometimes both couples were trained as activists, and sometimes couples who were activists, the partners of couples would still engage their spouse who had been trained as through the curriculum, but weren't necessarily activists, in terms of going through that 2-week training and kind of regularly being informed about activism. So, but they found that it really improved the dynamic when the partners were there. It kind of allowed people to really trust that, okay, like someone's speaking about changes in their relationship and their partner is there with them. And so actually it was found to be something really effective and something that the program we were talking about even last week should scale up in future, thinking about this couples activism. And overall, the community activists, they mentioned that it was important they were from the community and that community members could witness changes. In these kind of areas, a lot of people spoke about, you know, quite intimate things get shared with each other and people knew that something was different in their relationship. And a lot of them spoke about taking pride in wearing these vests and being identified as change agents and having links to the leaders, which I'll talk more in the next slide. They also, you know, one thing that was difficult compared to SASA, because it was in these rural environments, staff couldn't necessarily meet with the activists as regularly, and sometimes it was even difficult to monitor certain activities. But they very much drew on the other couples that were trained for support, as well as RWAMREC staff as well. Okay, and what we're learning from the women's safe spaces, just to kind of change gears a little bit. Again, the activism and the dialogues seemed to be really relevant. It is what drew people to go, knowing that there were different discussions and dialogues that would take place. The fact that the women's space facilitators were from the communities also meant that they could be drawn on for support, they could be related to, but like the activists, they also required ongoing support and ongoing training from Rwanda Women's Network, especially around participatory approaches and providing empowering responses. Many attendees were very much motivated for the income generating activities that took place, and also a lot spoke about just the opportunity to connect with and share things with other women, and also the skills building emphasis, as we saw, was also so important in the couples curriculum. This included things like relationship skills and also handicraft skills as well, related to the economic empowerment. So the safe spaces were open to men, particularly anyone could disclose in the morning, and they decided to also have some days where men could come and women could even bring their spouses. But they also found it important to have women-led spaces in this setting. And just because of limited time, won't go into that, but we can talk more about that in the discussion. Another interesting finding is that they were very much talked about as preferred spaces to disclose IPV, and it really brings forth the importance of having these informal sources of support. And that was for things like knowing it was confidential, knowing it was non-judgmental, and knowing that it might not lead to consequences like having to pay a fine or leading to arrest of a partner or something disclosed, which were concerns people had raised for other formal sources of support. But what's also important, because they had raising awareness, they had the referral and accompaniment, it still could improve access to formal services for those who wish to access those. And then my last kind of slide around a lesson learned is the fourth component, the opinion leader engagement. Again, very much appreciated the participatory training and many how areas were relevant to their own work. It really brought forth the importance of engaging leaders. I mean, especially the village leaders, if they hadn't been engaged and trained, the program found it wouldn't have been possible to do activism, particularly in the Rwandan setting where people want to know what is being disseminated. There's a lot of decentralization, and so they were absolutely critical to get on board. They also provided opportunities for and were said to kind of enhance legitimacy of the activists as well as the women's spaces. There was also concerns though that they could place demands on them and how the program had to navigate those power dynamics. But overall, the quarterly meetings where the program brought together opinion leaders, activists, and women's space facilitators was critical for these linkages, and also as been found to actually be critical for sustainability. So one example is that 5 of the women's safe spaces have now been incorporated into local governance, and that has been a big part because of the local leaders' involvement. We learned that it was important to regularly engage them. There could be quite high turnover, especially for local leaders, given local elections that happened in the middle of the program. And also the challenge for opinion leaders to self-evaluate or be monitored by Rwanda Women's Network staff, again, given those power dynamics and how the program had to consider those. So I'm going to wrap up and allow time for questions. And I know it's a lot of content, but I think we're also learning a lot about adapting other program characteristics. And some of these lessons are, the importance of allowing time for adaptation. So one thing to flag is Indashyikirwa had a 1-year inception phase, which was the longest inception phase that any of the program partners had been involved in. But in terms of the lessons learned and the impact, the positive impact, I think it really speaks to the value that was of that time. And also maintaining fidelity to evidence-based principles, but also encouraging innovation and responding to the context. And this is where things like fidelity briefs can be really helpful. And I want to just flag that the SASA fidelity brief was extremely helpful recently for us as a program to reflect on whether or not we were a SASA adaptation and why. And so why these are quite useful for the field. And also to think about the value of research informing adaptation. And so a lot of the content I've covered drew on some of the qualitative research, including research around social norms, but also the ongoing feedback from beneficiaries and in terms of informing some of the refresher trainings, identifying program challenges, and also identifying solutions and responding to the context. Okay, so those are my kind of some of the 3 key things. I think just in general before we wrap up is the model of this couples curriculum before activism for kind of holding couples accountable to their changes because they are acting as activists. A lot of them spoke about that it really supported them to maintain those changes. It also, the value of couples activism came out. It equipped changes beyond just the couples train, leading to this enabling environment. And it also meant that those couples became quite close to each other who had gone through the curriculum and could support each other as activists. But the program model, has really emphasized how popular these safe spaces were, especially in contexts with limited awareness or access to services. So again, thinking of a continuum with prevention and response with GBV programming, and the critical importance to engage opinion leaders for this broader enabling environment, and as we're learning, sustainability as well. Okay, so I know it's a lot of information, but I will wrap up there and hand over to James, who's going to facilitate discussion and allow you all to engage as well.
Thank you so much, Erin. That was great. And I know it was a lot of content, and we have 7 or 8 clarification questions reflecting that. And so for the panel, for the participants who have given these questions, I'm going to read them out. But if anyone would like to speak after this clarification section, again, please go back to the chat box and indicate that you'd like to speak, and you can unmute yourself. So Erin, I'm going to read out a couple of the first clarifications. Within the universe of the VSLA group, how were the 840 participants selected? Did they choose to participate, or had they all undergone the journeys to transformation in the past? That's one. Right. And then the second question I'm going to give you is, you said that there were community scorecards to hold opinion leaders to account. Could you say a bit more about those community scorecards, and what were they assessing exactly, and what standards or expectations were the opinion leaders being held accountable for? So those are the 2. The first one on participants.
Great. Thanks. So for the couples selected, there was criteria. The criteria was that they had to be either married or living together for 6 months. And this is because, in Rwanda, there's actually, it's quite a high marriage rate, or at least cohabitation rate, and not a lot of kind of multiple partnerships. So it responded to the context. It also was because the program really was targeting couples. And so that was the criteria. They had to be between 18 and 50. And then the criteria was that the female part, or at least one partner, but primarily the female, was a member of the VSLA program. Some had been through JOT, but many hadn't. And it was a self-selection. They actually found that so many people wanted to do it that they had to have a lottery because it was extremely popular. So it was a kind of self-selection, and it wasn't framed as just, and it was framed as a couples curriculum around healthy relationships. And so it wasn't just kind of being self-selected based on experiences of IPV. There was none of that kind of taken into account. It was but it was a very popular curriculum to self-select to. In terms of the second question, so the community scorecards were something that kind of evolved at the end. And I mean, the program actually reflected that it would have been useful to integrate it more from the beginning. And this was really used because they found that, so opinion leaders would commit to different areas of GBV prevention and response. So whether it was they would speak about it at certain events, or they would bring up certain advocacy issues, and then they would self-evaluate. But they found that when opinion leaders self-evaluated, they would just rank themselves as having done everything kind of perfectly. And they also found that staff didn't necessarily feel comfortable kind of holding opinion leaders to account, or monitoring, or asking them what they've done and what they haven't done, the same way that they could monitor and support activists and women's space facilitators. And this definitely speaks to the quite hierarchical society of Rwanda that the staff themselves were embedded with. They mentioned that they had some of these dialogues where they would use community scorecards where community members could reflect on whether they think there's been a change in GBV prevention response through the opinion leaders' efforts. And they actually found that this was really helpful because it negated that it wasn't staff with the leaders, it was community members with the leaders. And it very much relates to Rwanda, which is that there are these very strong hierarchies, but there is also a very strong sense of community accountability. So they found that it worked quite well. But it's an area that was kind of an ad hoc because they were finding the other monitoring and evaluation with leaders challenging. Yeah, that answers your questions.
Okay, thanks, Erin. Now, can you see, you can open up the chat box to see the questions, but I can read a few more. And then just to remind all participants, if you would like to talk and don't mind being recorded, please just let us know. But in the meantime, I'm not going to mention any names, and I'm just going to continue to read off some of these questions. So the second group, I think you've answered some of this in your previous response, Erin, but can you share anything about how the volunteers or activists were incentivized?
Mm-hmm.
And were there any challenges to keeping those activists participating over the course of the program?
Yeah, thanks for that. So the activists were given kind of, because it was a very rural environment, and sometimes activists would be leaving their village to go to another village. There was a very small kind of travel stipend that they were given every month when they met, but it was much less than even the couples curriculum was. It was really for limited in terms of some activism content. They actually found, as I had mentioned, that more than 25% of partners of couples wanted to be activists. I think a big part of this in these communities, like I mentioned, having the access to local leaders, the kind of going through this kind of a training, having these vests and being identified as change agents. And then again, the commitment because of how they had benefited from the curriculum, they actually found there was very little dropout and that there was actually more activists than they wanted to engage. And in the last year of the program, they trained an additional 80 activists just to respond to that need. Yeah, so overall, really high levels of dedication. I mean, there are now concerns, and we were discussing last week of now that the program is ending, will they be able to continue, particularly without the monitoring and support from RWAMREC staff, the regular monthly meetings, and that where they did get that small stipend. But there does also seem to be a lot of promise of commitment or support from some of the local leaders, and they are in discussions about trying to have more institutional support, but it is a kind of gray area at the moment how that commitment will continue. But throughout the program, actually very strong dedication. Yeah.
Great. And this goes back to what you were mentioning about the strong marriage laws. Rwanda ranks highly for being gender progressive and has strong family laws that protect women and children. It is one country where the state promotes monogamy and marriages can be registered right down to the local level. Do you think this helped with the work with couples? Do you think we could replicate this in other countries where marriage and family law is not as strong?
No, it's a really useful question, because I think now one of the things that we're thinking about is what this means for other contexts, and I think this would definitely have to be considered and potentially adapted because of that. I do think that it did mean that there, because it is something that is so promoted, it meant it was a kind of social identity and category the program could work with. It also, though, did bring up distinctions. So interestingly, we found that because the couples engaged, they were legally married or informally married, cohabitating. And in Rwanda, that can actually be known as illegally married, which is very stigmatizing in itself in a very law-abiding society. And that, some of the reason that people are not marrying is the marriage registration fee or just the cost of weddings, but that a big reason coming up is men actually resisting marriage so that their spouses are not do not have rights to things like the property law that really only covers you if you're legally married. And so the program we had to think about how to consider those distinctions. I mean, one interesting outcome is I think about 120 couples legally married after the program, as ways of kind of asserting these rights or guaranteeing these rights for women, but also that, that's then being promoted as a kind of status over other ones. And so I think definitely for this program as well and other programs to be very sensitive of, what do those dynamics mean among couples and what ones are elevated over others, and how to consider that for programming is a really important question.
Thanks, Erin. Again, just to say, if you want to go to the chat box, you can see these questions, but I'm going to continue to read them. And anyone, please let us know if you'd like to speak. So the next question is around the safe spaces, and particularly the morning periods focused on response. How did it work to be open to both women and men? And are there any observations around who used the space primarily and for what types of cases?
Yeah. Thanks for that, because I wanted to go more into it because it's been a real kind of almost a contentious area for the program, how to have these women's spaces, how to also engage men. What was interesting is at the beginning of the program, they kind of expected only women would want to use them. But actually they found that a lot of the women were saying they want their partners to be there. And they had heard about this couples curriculum. They're like, they also want their spouse to engage and understand what they're going through. And so the program wanted to respond to that. And so they did have, for those group discussions in the afternoons, it was still primarily used by women. And a lot of the women spoke about being very unique to have a women-led space in the Rwandan context, and this context in particular. And the income generating activities were especially attractive, and just like opportunities to connect with and speak openly with other women. But when they did have women invite partners, or when there were days that were open to men, men also came and very much appreciated them. And actually what we ended up doing, we interviewed 2 male safe space attendees of the spaces at Midline, as requested by the staff, because they wanted to understand why are men engaging and how do they find it. And, you know, they actually mentioned that when they went, it made them more supportive of their partners being engaged, but that they also would appreciate more engagement. Some suggestions were things like having male facilitators. So all of the facilitators were women, the facilitators who ran the spaces. A suggestion to call them family safe spaces instead of women safe spaces because of who that excludes. So it's an area that, you know, was kind of an ongoing reflection. In terms of the individual disclosures, again, primarily women were reporting violence, but the spaces did find some men also reported violence, or just reported, you know, conflict and wanting advice. Maybe a lot of facilitators would do home visits as well, and sometimes it was prompted by the man. So I think it was really important that it was open to both. What they did find though was that there was still a need, and even some women kind of spoke to facilitators that they still wanted it to sometimes be women only. And so the program was really trying to balance those needs to engage both men and women.
Great, thank you, Erin. Next question is, I'm interested to know more about the type of activities that came under community activism in this project.
Yeah.
And were there any factors identified as contributing to violence which were not a focus of the activism? And if so, what were these?
Okay, great. So the first, in response to your first question, a lot of the activism activities were adapted from the SASA activist toolkit. And so these include, you know, informal conversations or ways to support participatory dialogue, and using things like there's these power posters, the posters that I had the example of, or, you know, reflecting on different ways that people use power negatively and positively. You have a poster and an image, and then that prompts a participatory discussion, you know, using with the people present. They had things like local, like quick chats with just, again, a scenario that you can talk about. They used a lot of community-based drama. So things like, you know, an example of if someone reports violence, how should you respond, and showing the kind of implications of it through drama. So using ways to really get people to reflect and dialogue and have a participatory approach, similar to what happened in the curriculum, but at a community-based level. And there was also kind of like informal trainings that were used by the facilitators and activists, or more just, yeah, informal discussions. But those were, again, that SASA activist toolkit, a lot of it was adapted for Indashyikirwa. In terms of like kind of key factors, not just that contributed to violence, but that contributed to kind of gender inequalities in the region. You know, as activists were starting to engage, a key thing that kept coming up in terms of resistance was religious norms. You know, religion being used to justify inequalities, sometimes being used to justify conflict or violence because of these inequalities and hierarchies. And so the program, you know, as they evolved, they actually got religious leaders involved in identifying more messages from religion that can be used to promote equality. They also drew on some of the SASA faith materials. But there was, yeah, definitely things around the context that kept coming up as needing to be integrated into the activism. And I do think one of the lessons learned is the value of adaptive programming. DFID Rwanda, I would say, is a kind of external, but was a very adaptive funder. They were open to like log frames changing, to materials changing, to time frames changing in response to the kind of contextual realities coming up on the ground.
Thanks, Erin. This is a very concrete question. Did the project include any training for police, health workers, or social workers in the formal service system?
Yeah, thanks so much for that. Yeah, so it did, in terms of the opinion leaders that were engaged at the very beginning through the stakeholder mapping, and went through a 2-week training. So it was over 10 days, half days. And part of it, they were integrated in terms of the broader opinion leader training, which looked at, you know, types of power, causes and consequences of violence, but also raised awareness of rights and laws, which some service providers mentioned was helpful for them. And it also had a very strong emphasis on providing empowering responses to survivors, including things like non-judgmental and confidentiality. So in that sense, some of these providers from police, health, or social workers were engaged in that initial 2-week training, and then also through the quarterly meetings where they would meet with staff and as groups think about like commitments or things that they could do to improve prevention and response to violence in their communities, and then reflect on their progress. And they did that over the remaining 2.5 years of the program. Hello?
Yes, hi,
Okay,
sorry
great.
about
Just
that.
making sure.
No, I muted myself. Just to say, we have about 15 minutes left, and there still are some questions, but I just wanted to, give people a chance to talk directly, to give reflections if they want. Again, please indicate to us that you would like to speak. And in the meantime, I will go on to the further questions. The next one is about how the components complemented each other and built on learnings from SASA. The questions are couples who have gone through the training and then become activists. This is a interesting innovation. Did you see any issues arising where violence might have continued within the household, although the folks were serving as activists? And how did the team handle this? And do you have an idea of how many men use the women's safe spaces to report IPV? You mentioned this a little bit, but if you have any more specific details.
Yeah.
And sorry, and if this, and then how the reports were handled differently for male perpetration and male victimization.
Yeah. Okay, great. Thanks for that. Yeah, in terms of, we actually were reflecting on this even with the program team just recently, because a lot of the couples spoke about being activists and even volunteering to be activists. So because, as I mentioned, that only 25% of the couples trained could be activists there, and it was actually quite popular, more than that wanted to be activists. So it was people that were selected or elected within the group for either having kind of gone through quite a significant journey of transformation themselves or being very committed to it. I think because of that, we did, the program monitoring did suggest that, there definitely was, backtracking and resistances and some couples going back to conflict or forms of violence, but that overall there was a really strong commitment to behavior change. I think particularly in this setting, because a lot of the activists spoke about, as I mentioned, wearing these vests and kind of being outward facing, that it's a very high accountability, a sense of accountability in Rwanda. And so talked about, if they were speaking about these issues and, using violence themselves, people would call them out. They wouldn't trust them. It would kind of they wouldn't have legitimacy. And so in a sense, there was a real accountability mechanism through that. They did mention there was one male activist that was continuing to use violence, and the program team, and it was just known, decided to ask him to step down as an activist, and that they continued to support him. And his wife was actually an activist, and she stayed as one. But that was an example of where it did seem that, he wasn't, the program team and some of the other activists raised that he should step down in his role but still be supported. So that's just an example in response to that. And in terms of the spaces, for the individual disclosure, there was actually much less than going for the group discussions. That seemed to be more popular for the men to go to than for the individual disclosure. In terms of how they were handled, again, it was really a case-by-case basis, and it was, you know, whether it was a man or woman, sometimes people just wanted to talk openly to someone, whether it was, you know, and have that confidential space. Sometimes they did want help, and including with a few examples of perpetration or just help with conflict, and there might be home visits to the couple. And sometimes they did want referral to formal services, which I think was much less common for men. So it really just depended on the case by case basis what support was offered. But as I mentioned, all the facilitators that the men would have gone to were women kind of trained from the community. So they didn't have male facilitators to respond, which did come up as an issue on behalf of one man.
Okay, quickly, Erin, just on a related question, if any of the couple sessions generated or triggered conflict that might have already existed, so conflict or IPV, and if so, how was that handled?
Yeah, so actually an important learning that came up in the pre-test was, you know, that this can be very emotional and very sensitive for couples reflecting on violence. And the, you know, the need to have the male and female facilitator was in case someone sometimes got emotional or upset or wanted to leave the room, that one facilitator could kind of hold that space with them. And also because they actually found that not necessarily in the sessions, but after the sessions, a lot of couples came forward and wanted advice or counseling or just to talk with the facilitators, the RWAMREC facilitators, that they actually got quite close to and trusted them. And it was actually something that the program did have some kind of psychosocial support training for the staff, but built it in even more strongly because it was coming up as such an issue. And so, you know, I think the learning and the need for that mental health support and response really came up. In terms of kind of monitoring for whether it increased or triggered violence, this is where it was again critical to have the two facilitators having the kind of take-home reflections. Sometimes they would also separate men and women in case, you know, people would be more open. And then they also had the women's safe spaces where people could be referred for more support. So I do think that regular program monitoring and dedicated support for response was critical. But I think for the most part, because of the way that the curriculum, you know, it's not this kind of couples, as we tend to think of like couples therapy and getting people to kind of talk about very individual experiences. It's really was facilitated, meant to be in a very safe space with very effective and very well trained facilitators, which I think is an important learning as well for holding that space. And also I think the violence discussions kind of come up in around like session 5 or 6, so that people have already kind of built that trust and rapport as well. Yeah.
Okay, thanks so much, Erin. I'd like to turn to Lori Heisey to share a few reflections.
Yes, thanks, James. So I was also working with Erin on this project for the last 3 or 4 years. And I think one thing that didn't come up as much in Erin's presentation that I found very interesting to think about is one of the initial challenges that the implementing partners faced was sort of how to think about doing some of the similar type work to what SASA did, but recognizing that it was going to be taking place in areas that were far removed from the host the sponsoring organizations, and across a very wide area. So, you know, and I think one of the things that in the SASA model, SACOVIP, the local group that helps implemented with Raising Voices, they're more or less co-located in the community, in the community in Kampala that they're working in. I mean, obviously it's a big community, it's a peri-urban area, but it's possible for community activists and the outreach workers to interact, as Erin was saying. And so it was possible to sort of help develop and support the community activists over time. So, you know, give some information, have them go back into the community, work on that, come back in, get more information. And, so you could build up a set of community activists over, 18 months or something like that. That's really impossible if you're dealing with huge distances, because you can't afford to bring everyone back into the capital, for example. And so one of the reasons to move to this model of couples, critical consciousness raising amongst couples, was to have a way that was more systematic and more condensed in order to prepare people to be community activists, recognizing that, that they were going to be kind of thrown out there in their communities without, they needed and they got a lot of ongoing support, but not nearly the degree to which I think the SASA provides within in Kampala. And the second thing is that when we did the evaluation and worked with SASA to figure out sort of how it worked and what kinds of changes were going on, in addition to the shifting of norms, there was more than I think even SASA, even Raising Voices, expected in terms of shifting dynamics within couples, even though it really wasn't focused on couples. But there was some really important things that were happening at the level of couples, especially those who were trained as community activists and got more intense engagement with the content. And so we decided that it would be good to capitalize on that and actually try to engage, to build off of that as its own component to change in addition to the community mobilization. So I just wanted to kind of throw that out there too, because I think it really was part of the reason that things got somewhat designed as they did.
Great, thank you so much, Lori. Erin, I'm going to ask you to have some final reflections. There were two further questions that you can see, and these are around both the adaptability and scaling up. So any future thoughts you have on how this might be adapted or scaled, and you might want to look at these questions to get more specifics, but. Just wanted to note to everyone, we did promise we would end after 75 minutes, and you're welcome to stay on for a few minutes. But Erin, I'm going to turn over to you for final comments, and particularly anything about, further adaptation and the scale.
Great, thanks everyone. No, it's a really important question that we're all now really grappling with. And actually, as I mentioned in the presentation, I think when programs like SASA that are being adapted and have evidence, have things like these fidelity briefs in terms of what they think were like the key things that worked, but what also programs need to consider and can, revise depending on budget and staffing and context. And I think it's an area we definitely want to work on for Indashyikirwa, and I think will be really important because there are a lot of really insightful learnings, but many that will have to be, considered within the context, and kind of our job to pick out what are the key things that you would need to do to have a kind of faithful approach to Indashyikirwa. In terms of, I think there's a lot of learning that SASA itself was difficult for the new partners to pick up. I think the phased programming and these community activism, both were very new to the partners. Curriculums, as I mentioned, is something that they were much more familiar with and was much easier to kind of move forward with. But I do think that because of that, the curriculums have a lot of adaptability, because I do think, it can definitely be the low-hanging fruit for programs to kind of draw on curriculums, but at the same time, as Lori even just mentioned, like the way that the program worked in this context, in a very rural, widespread context, having this quite intensive curriculum was found to be a really useful basis to then move into activism. And then I think for this kind of context, it would have been much more difficult to go straight into that. So I think there's a lot of potential adaptability even from these curriculums, and given that they are designed on evidence from other programs like SASA. And then in terms of cost dimensions, so it's an important point because this was actually quite a resource-intensive program. Part of that is having the 3 partners, and there was a lot of innovation and kind of piloting needed. But there is a costing evaluation also being happened as part of what works that's ongoing, and that will be extremely interesting to think about kind of the cost-benefit analysis of this program, also quite important for adaptability and scale-up purposes, but that is still being ongoing. And then in terms of some other questions around sustainability, so as I mentioned, I think about 5 of the women's safe spaces of 14 are now they're part of the government, like the government's taken them over, and the program is pushing more to get taken up. And then currently they're in discussion of how to kind of continue to use particularly the activists and the women's space facilitators, who are now this really this cadre of trained and committed people, and the government and local leaders in particular have seen the benefits of having them in the community and playing a role. And because there is such strong political will in Rwanda, and because of the kind of engagement with local leaders, I do think there's a lot of promise, and there's a lot of kind of interest in sustainability, but it's still an area that is kind of ongoing. One other thing to mention, though, that is going to be critical for sustainability and has been critical just for implementation, is that the Ministry of Gender in Rwanda has been on the advisory committee to the program, and is also very interested in this program, and very supportive of kind of scale-ups or just lessons learned of it as well.
Great. Well, Erin, thank you so much. I mean, on behalf of the Prevention Collaborative, I really heartfelt thanks for the time for putting this presentation together and giving this webinar. And to all the attendees, thank you for your questions, and I hope we've been able to answer them. I know we're just scratching the surface of the rich learnings that will be produced, that continue to be produced from this program when the RCTs and the costing evaluations and other pieces come out. So just to once again say, the practice briefs that go into the different components that Erin has discussed today we sent those out. They're on the What Works website, and there'll be other materials coming out from the different components of the evaluation. So continue to watch this space. I'm sure Erin is available to answer any questions offline. If you would like to contact her or me, I can put you in touch. And continue to watch this space for the subsequent webinars in our webinar series. We will be focusing on some of the practice briefs that the Prevention Collaborative is producing, including a very related one on working with couples, and also on community facilitation and what that means. And we have some other exciting ones coming up in the next couple of months, and so you'll be hearing from me. But I think you've heard from me enough today, so thank you all very much. And with that, I am going to end this webinar.
Great. Thanks so much.
Thanks. All right. Goodbye, everyone.
Thank you.